Welcome to our Moving with MS virtual support group. I'm Dr. Gretchen Hawley. I'm a physical therapist that specializes in helping people with multiple sclerosis through functional exercises and neuroplasticity techniques and strategies. And I partner with MS Visa News, so every month we can offer a virtual support group where we touch on a different topic that in some way, shape, or form pertains to MS and improving mobility and strength, function, and ease in daily activities. So this month we are discussing pelvic floor stuff, urinary incontinence issues, bowel issues, sex, everything that happens with our pelvic floor is such an important thing to discuss. And so often people are embarrassed to talk about it, but it is a real symptom that can be caused from MS. So it's important that we talk about it. And we're going to end today with some exercises that you can try to help your pelvic floor. With that said, we'll get into much more specifics, but I just want to put this out there right now that there are physical therapists that specialize in pelvic floor. I am not one of those physical therapists. I specialize in MS, but there's a lot of them out there. And so I would highly recommend, if you are someone that resonates with this topic that we're discussing, you seek out an in-person physical therapist who has that specialty of pelvic floor. They're sometimes called women's health physical therapists or pelvic floor physical therapists. Oftentimes they also work with men too, but that if you are a man and you're listening to this, you would want to ask the clinic or PT that you're calling if they also work with men, because some only work with women. I partner with MS Visa News to bring our Moving with MS support group, and I always like to mention our supporter Viatris. A huge thank you to them. They are the reason that this program can continue to run year after year. So thank you so much to our supporter Viatris. Okay. So we're going to be talking about bowel, bladder, pelvic floor, all the stuff that happens down there and how it relates to multiple sclerosis and what you can do about it. So we're going to talk about different types of pelvic floor conditions, management guidelines, sexual dysfunction, and of course end with some exercises. So I don't know about you guys, but I always like to know the why behind things, specifically symptoms. And it can be hard with multiple sclerosis to know why something is happening or what lesion is causing what. But when it comes to pelvic floor symptoms, we actually do have a little bit of clarity here. So where are pelvic floor symptoms like urinary symptoms and bowel symptoms? Where are these coming from? So recent research has shown that with urinary symptoms, and we'll get into what symptoms we're exactly talking about, but with urinary symptoms, they tend to come from lesions in the pons or midbrain. These are two different sections of your brain. And we've also seen that it can occur due to sacral demyelination. So if you have demyelination in your spinal cord, the sacral portion is the lowest part of your spinal cord. So if you have demyelination there, that might be one reason that you have urinary symptoms. Bowel symptoms have been associated with demyelination in the frontal lobe. So this would be brain lesions and demyelination specifically in the brain in this frontal lobe. There's several different lobes. This is where the frontal lobe is. And why do we need to talk about this? Because it's actually more than just about urinary symptoms and bowel symptoms. Of course, we want to improve those whenever possible, but urinary symptoms and bowel symptoms often lead to a high fall risk. And if you're a high fall risk, you're likely to get injured. And if you get injured, that can mean that you get even more weakness and you're more sedentary, and it can be a huge downward spiral. And I don't want to scare anyone. That's not my intention of mentioning this, but my point being, if you are someone who has urinary symptoms, bowel symptoms, the sooner we can get a handle on it, if possible, the better, so that you don't become a high fall risk. We want you to keep your strength, keep your balance, get stronger, get better balance, get better mobility, even with some urinary symptoms that might be happening. when you think of urinary symptoms or bowel symptoms, sometimes they happen in the middle of the night. And if you don't have the strength and balance and speed to get to the bathroom, that can cause a fall, especially in the middle of the night when you might not have your mobility aid there, you might be rushing. So we want to find a way to help manage some of these symptoms whenever possible. Okay. Oh, and I see a question, will this be focused on women's or men's? Both, absolutely. Everything we're going to be talking about pertains to both. Would a bladder sling help? So we're going to go into what different symptoms are and then things that can help. So when it comes to, we're going to talk about urinary first and then move to bowel. So for urinary or bladder symptoms, conditions, they can be due to weakness or tightness or MS. There is a different type of urinary and bowel symptoms when it's just due to the demyelination versus due to weakness in your pelvic floor muscles or tightness in your pelvic floor muscles. And I'll say this several times today, but one of the best ways to figure out why something is happening is to see an in-person physical therapist that can evaluate you. So often we might think our pelvic floor is weak or think that it's tight, when in reality it's actually the opposite, or it's both, or it's none. So getting real data for you and your body is going to be really important. So urinary conditions, there's something called urinary urgency, and these are all different types of urinary incontinence. Urinary urgency is when you have a sense of just having to go to the bathroom, urinary or bowel, but right away, and often it's unexpected. It just hits you, and if you don't go right then and there, you're going to have a problem. You're going to pee when you didn't mean to or poop when you didn't mean to. It is urgent. That's urinary or bowel urgency. Frequency is when you just have to go frequently. So it's not necessarily urgent, but you just have these frequent urges to urinate or have a bowel movement, and it results in going to the bathroom frequently. Whether you actually have a urinary or bowel movement or not, you just feel that frequency of having to go. Urinary hesitancy is when you have difficulty starting to urinate or sustaining a steady stream. This can also apply to bowel movements, but it's the same concept. Again, difficulty starting or maintaining a steady stream. And then urinary retention is when you have the inability to fully empty your bladder or bowels, but you keep some of that in you. And it's because, for several reasons, but your body is not releasing all of it, it's retaining. So these are the main 4 types of urinary incontinence or bladder incontinence. There are others, but these are the main ones. Now, it's important to differentiate neurogenic bladder. So neurogenic bladder is the type of bladder that is caused from the disease process of MS. And here's how it works. The nerves that carry the messages back and forth between our brain and our spinal cord and our bladder don't work the way that they should. Normally what should happen is we've got the nerves that start in our brain, they go down the spinal cord into our bladder, and they're constantly communicating back and forth. That's why when we get this sense of, oh my gosh, I have to pee, it's our bladder feeling like it's full, sending that message up through our spinal cord to our brain so that we can make the decision to go to the bathroom or hold off. But with MS, when there's lesions, when there's demyelination, that connection often does not work as well. So it's not necessarily that the muscles are weak or the muscles are tight or any of that. It's that the connection, the neural pathway isn't working as it should. Symptoms of this type of bladder condition would be urinary leakage, UTI or urinary tract infection, urinary retention, like we talked about, kidney damage or infection, and the treatment is often different. The treatment for what we talked about on the previous slide is mostly physical therapy. The treatment for neurogenic bladder is often urinary catheters, antibiotics to help reduce the risk of infection if you are getting lots of infections. In severe cases, sometimes surgery. There are medications that are options. So these are the types of treatments often associated with neurogenic bladder versus these other ones that are associated with weakness or tightness. Okay, so urinary guidelines outside of physical therapy or physiotherapy and exercise, which we'll talk about. Adequate fluid intake. And I always like to mention this one first because so often, and if you have any urinary symptom, let me know in the chat. Have you reduced your water intake because you don't want to put yourself in a situation where you have urinary incontinence, urgency, frequency, leaking, anything like that? And the reason why I'm curious about that is because so often the answer is yes. And not being hydrated, not keeping up with our fluid intake, specifically water, can make urinary symptoms worse. And it sounds counterintuitive. Oftentimes people who have urinary symptoms will just stop drinking water, or they'll drink less because they don't want to be in a situation where they're at risk for leaking or having to go and not having a restroom nearby. And that often makes symptoms worse. So making sure you're staying hydrated, adequate fluid intake, generally speaking, everyone's going to be a bit different, but 1.5 to 2 quarts of fluid a day. Oftentimes it goes by body weight. So if you take your weight in pounds, divide it in half, and that's how many ounces. So if you weigh 200 pounds, theoretically you would have 100 ounces of water a day. That is throughout the day. You don't have to chug it all at once. You can have tiny sips throughout the day. If that's a big jump from where you are now, you wouldn't start there. You would work your way up to it. But making sure you're getting your fluid intake, because limiting your fluid is harmful and your body won't work as well. If you're not staying hydrated. Avoiding or minimizing bladder irritants like caffeine, aspartame, alcohol, and smoking. Timed voiding is when you basically time when you go to the bathroom. So generally speaking, if you've noticed that you have urinary frequency or incontinence around similar times, then you can plan what times you want to go to the bathroom, and you set an alarm on your phone and you go before you get that urge. This can help with safety because you can walk slowly to the bathroom versus rushing and potentially causing a trip or a fall. And then hot baths as well. This is only if you don't have heat intolerance. If you do have heat intolerance, hot baths are not a good idea, but a hot bath can sometimes help you go, especially if you have urinary retention. I'm just gonna look in the chat over here. Where am I? I lost my spot. I see Lori says, at the onset of my MS, I had urinary urgency and hesitancy. At first, I thought it was job stress. I had the inability to void completely. Yes, that would be that retention. Urologist suspected MS and sent me to a neurologist. Oh, that's so interesting. So that was your first symptom. Is it typical to have a combination? Great question. Absolutely. So we've gone over a few different types. You can absolutely have more than one. Very rarely is it just one or another. I have trouble getting my necessary fluids. Yeah, that's really common. A bunch of people saying yes, sometimes, a few saying no. Alicia says, no, I have learned that limiting fluids doesn't solve the overall problem. The only exception is when I travel. Yeah, I used to limit water for this reason, but now that I increased fluid, it's better. Yay, I'm so happy to hear that. Awesome. Okay, let's move on. So when it comes to the urinary bladder management, there are, again, medications or surgeries in some cases. Medications are going to be different based on your neurologist, but generally speaking, if there are frequent urinary tract infections, then you'd want to treat that first. So treating the UTI, usually with antibiotics. Anticholinergics can help with overactive bladder, just one that might be more symptoms like the frequency and urgency. Muscle relaxers sometimes can help if there is a level of pelvic floor tightness that physical therapy isn't touching. You would typically want to do physical therapy first, just because if you do physical therapy first, you might not need that additional medication, but sometimes it is both. Estrogen inserts can be another one, catheters, stimulation devices. Someone in the chat earlier mentioned a sling, and then of course pelvic floor physical therapy. So all of these are different options that you would likely discuss with your neurologist. If they aren't bringing it up, you should bring it up. These are some options that you've heard. Would any of these be appropriate for you? Okay, so we're going to come back to the exercises in the pelvic floor discussion, pelvic floor physical therapy discussion, but first let's touch on bowel conditions and bowel management. So when it comes to bowel conditions, the most common one that is associated with multiple sclerosis is constipation. That's not to say that that's the only one, but that is the most common. The number one reason that a lot of people have constipation, with or without MS, but especially with MS, is dehydration from bladder dysfunction. So oftentimes, people who do have urinary urgency or frequency incontinence are also the ones that have constipation because they're trying to prevent urinary symptoms by reducing their water intake, and then they have constipation. Not always. It's also possible to have constipation without any urinary symptoms, but generally speaking, this is what research has found. Other causes, though, so the number one cause is not having enough water, not getting enough fluids. But other causes is the inadequate neuro and gastrointestinal signaling. Again, as we were talking about before, our body needs to send messages to our brain, whether it's our bladder or our bowels. We need to feel when we need to go, when we're getting full, and when we need to empty. That needs to go to our brain. And then we actually have to go to the bathroom. If that signaling is off, that is a big reason why we might not go when we actually need to. That can lead to more constipation. Inadequate muscle relaxation. If you are trying to go to the bathroom, if you're trying to have a bowel movement, but you just can't relax your muscles, then more likely than not, you're not going to be able to go. It's going to be really hard. And then last but not least, decreased abdominal tone. One of the coolest things that I heard from working with my clients with MS, generally speaking, I primarily focus on helping my clients walk better. That seems to be their main goal. And in doing that, we work on core strengthening. And so often when I'm working heavily on core strengthening, the person I'm working with will say, oh my gosh, Dr. Gretchen, I know we're working on walking and core strength, but I gotta tell you, my urinary symptoms are so much better, or my bowel symptoms are so much better, even though we weren't even working on pelvic floor stuff. But having a stronger core can significantly help with bowel and bladder function. So with constipation, or with bowel conditions, we know constipation tends to be number one. Other options, though, are incontinence, urgency, so very similar to urinary urgency. It's just the sense of you need to go and you need to go now. Hesitation, constipation, and diarrhea, which would be the opposite of constipation. Okay. I see in the chat, Lori says, I found an antibacterial beverage recipe online that healed a recent UTI. I avoided the antibiotic route. Ooh, that's awesome. If you could share that with us, Lori, that'd be great. And I can share it with the group. That's very cool. Okay, so bowel guidelines. So the first guideline almost everyone should follow is to eat more fiber. A lot of us do not get enough fiber throughout the day. So eating more fiber would be things like fruits, vegetables, beans. Eating breakfast, so often we'll skip breakfast for whatever reason, but eating breakfast can set our bowel movements up for the day. Eating breakfast should be one of our biggest meals, and it basically wakes up all of our signaling. And so by eating breakfast, during that time frame where our bowels are most active, which tends to be in the morning, you're going to be more likely to have a bowel movement because you're giving it something to process. So Don't skip your breakfast. Massage. There is a massage. Let me stop sharing my screen for a second so I can show you. There is a massage that you can do. It's nicknamed the I Love You or the ILU massage. This is something that you can do right now. It's something that you can do while you're sitting on the toilet, but you want to be relaxed. And you're starting over on your right side. So down at the right hip, you can use one hand or two. For some reason, I tend to use two, where you come up and you're making the letter I. So you press lightly and come up. And you do about 10 repetitions of this. And then it's the L, an upside down L. So up and over. And you do that about 10 times, just lightly pressing. Once you've done that, it's the U. So up, over, down. Up, over, down, and you're lifting and moving. And this is the way that our bowels work. Our bowels move in this direction, or moves our food in that direction. And so we're trying to help our bowels out by massaging and trying to get the what's the word I'm looking for? The contractions to occur. So that is a massage that can be really helpful. You can do it throughout the day. Again, as I mentioned, while you're sitting on the bathroom. If you have pretty frequent constipation, that's something that you could just do as you're watching TV. It's not going to make you poop. It's not like you're going to do that and you're going to need to go right away, but it's something that can just help with the digestion, help things move along, if you will. Okay. Again, we already mentioned, but making sure you're drinking enough fluids and getting enough of that in your daily intake. Adjusting medication regimens that might be contributing to bowel dysfunction. There are several medications that can cause constipation as a side effect. And so if that is becoming an issue for you, and because you're having these bowel side effects, it is putting you at risk for tripping or falling or I don't know, anything that is happening that you're not a fan of, talk to your neurologist about maybe switching medications. Is there a different medication that doesn't have that side effect, or is there a different strategy instead of that medication? Performing regular physical activity. And what I like to discuss at this point is this can mean going to the gym or exercising at home, but it can also mean going up and down your stairs, going to get the mail, walking around your home, getting dressed. A lot of our daily movements count as exercise, count as physical activity. So I don't want you to perform regular activity and think, oh my gosh, now I need to go to the gym now, or I need to walk on a treadmill or do the bike. You can do those things, but just move more throughout your day, even just standing up and sitting down. Every time you go to the bathroom, stand up and sit down 5 to 10 times after you're done going to the bathroom. Anytime you go into your kitchen, maybe do a few marches, just move a little bit more. It doesn't need to be anything huge. The goal for most people should be to have a comfortable bowel movement either every day, every other day, or every 2 to 3 days. Some resources say that you should poop 2 to 3 times a day. So it's going to be different for everyone, but it should be comfortable and it should be somewhat regular, even if it is every 2 to 3 days. For regular bowel movements, generally speaking, the recommendation is 1.5 to 2 quarts of fluid a day and 20 to 30 grams of fiber a day. And activity. It's got to be that combination. Okay, so when it comes to bowel guidelines for medications, it depends what the bowel symptom that you're having is. If you're having diarrhea, it would be more of the anti-diarrheal medication. Laxatives, if you're having more of the constipation. Bowel retraining, and this could be timed emptying, very similar to what we talked about for the urinary symptoms. It was timed voiding to empty your bladder. This is timed emptying to empty your bowels. Surgery, uncommon, but it is an option. Repairing damaged muscles or electrical stimulation tend to be the most common ones. Okay, before we get to the exercises, the last thing that I wanted to discuss was sexual dysfunction. Let me check the chat just to see if you guys have any questions. I see Lori shared the video. Let me copy this and share it for you guys. Sent to all. Thank you, Lori. Once I tried that massage while using a hot or cold pack on warm and burned my skin so badly, my primary care physician had to prescribe, oh my gosh, I tried that massage while using a hot cold pack on warm. So one thing that a lot of people don't talk about with hot packs or cold packs is that if you've decreased sensation anywhere on your body, you should not use hot or cold packs. And if you don't know, many people don't know. You just think, oh, let me put a hot pack on my stomach to see if I can help get things moving. But we don't often do that. So you might not know if you have lack of sensation. So if you are going to be using a hot pack or cold pack anywhere on your body, if you haven't used one in a while, stop to take periodic checks of your skin so that you just take it off. Look, is there any redness? If so, you might want to take a break and then come back to it. But yeah, I appreciate you sharing that, Lori, because that's something that not a lot of people think about. They just slap on a hot pack or a cold pack and they think they're good to go. And then it's not the case. I have to take you with me via laptop to put some peanut butter cookies in the oven, all gluten-free and sugar-free. I love gluten-free. Awesome. Okay, so moving on, sexual dysfunction. So sexual dysfunction occurs in the pelvic floor area, just like urination, just like bowels. And so I think it's a really important thing to discuss. Now, it's not a guarantee if you have urinary symptoms, it's not a guarantee that you'll have sexual dysfunction. Or if you have bowel symptoms, it's not a guarantee you'll have sexual dysfunction or conditions. But sexual dysfunction occurs in 62 to 83% of people with MS. That is a large percentage. Factors that affect sexual dysfunction tend to be fatigue, spasticity, pain, bowel and bladder function, and mood disorders. Now, there's lots of things that can affect this, but these are just some of the most common ones. And you'll notice that not all of them have to do with our pelvic floor. So sometimes just being fatigued can cause sexual dysfunction. We just don't have enough energy to start or sustain. And so with sexual dysfunction, it's really important to figure out what you think might be the single cause or potentially multiple causes so that we can address the right thing. If it is related to the pelvic floor, again, first and foremost, seeing an in-person pelvic floor physical therapist so that they can help determine the cause. Is there tightness that's causing sexual dysfunction? Is there lack of tone? Is there too much strength, which is possible? Is there too much weakness? There can be so many different things. So often we just assume, I think most of us assume if there's pelvic floor dysfunction, it's weakness and we should do Kegels. But in some cases, Kegels are not going to be helpful. And in fact, it can make things worse because you might have too much tightness. So I cannot iterate that enough. The in-person pelvic floor PT to help you figure out what might be going on there. Once you know what's going on, then you can take some appropriate action. If there is tightness there, try stretching before you have sex. And as unsexy as this might be, oftentimes what can be helpful is planning when you want to have sex so that you know, okay, 30 minutes before or an hour before or whenever it works for you, you're going to spend 5 to 10, maybe 15 minutes stretching specific muscles that attach to the pelvic floor. For example, our inner thigh muscles attached to the pelvic floor, some of our hip muscles attached to the pelvic floor. So by stretching those leg and hip muscles, it can relax the pelvic floor if you have tightness, and that's what's causing pelvic or sexual dysfunction. Okay. Again, pelvic floor physical therapists are trained to do this. They are trained to evaluate exactly what's going on and to treat. So get an evaluation if you do have someone, a clinic near you that does this. And I just wanted to talk just specifically around what that evaluation might be. We'll get into the exercises in a second. I'm going to stop sharing my screen just so you can see me a little bit bigger. So the next slide that we're going to do is some exercises, but Before I do, I noticed that a lot of people have questions about what to expect from a physical therapy appointment with a pelvic floor PT. So most times, the way that it works is you're going to go in, and at first it's just going to be like a regular physical therapy appointment. They're going to look at your hip mobility, hip strength, back mobility, back strength, leg mobility, leg strength. So often our pelvic floor issues and symptoms are not just pelvic floor. It's related to our hips or our legs or our back, our spine mobility, our breathing, things like that. So your clothes are on, they're just going to look at all those things. Usually there is some type of internal component where you will undress from waist down, and they will do an internal examination. For the most part, this would probably be less than 5 minutes. It's something where they will insert a finger and touch on specific muscles, and you can let them know, does that hurt? Does it not hurt? They can sense just from touching, is there too much tightness? They will ask you to squeeze in a specific way. A lot of people do Kegels incorrectly. So basically ask you to squeeze in a correct way for a Kegel, where they can determine, do you have the appropriate strength or not? They'll teach you how to do the appropriate way, to do a Kegel. So there is that little bit of internal component. If you don't feel comfortable doing that on the first day, oftentimes you can tell them that you don't feel comfortable and you'd want to push that to the second day or the second visit. I would highly encourage you, if you are comfortable, get the internal evaluation. Really good pelvic floor PTs can get a sense of what's going on without that internal part, but the internal part is what will make it super clear of exactly what exercises you should be doing right away. So you'll likely get some quicker results because they'll have better data. After that internal part, clothes come back on, and they'll give you some exercises to do and guide you with what stretches or strengthening exercises might be appropriate. So I'm going to share my screen again. I've got several exercises listed on the next slide. I'll verbally review them, and then we'll practice some of those together. Not all of them, but some of them. But just know that these are general ones. Again, getting the evaluation for yourself is going to be key, but the ones that I have here are going to be general guidelines that can help. So let's move on. Also, before we do that, let me just check the chat. I see Andrew says, I used the hot and cold packs, but I burnt myself and it left a mark. How do we remove that scar that we got 1 month ago? One thing, it's funny that you asked that, just because recently something that I've been seeing a lot of lately is silicone, the word coming to me is stickers. I guess they're kind of stickers. It's sticky silicone. Silicone can be really great for helping reduce the appearance of scars. And so you put medical grade silicone on wherever a scar is, and that could be helpful. But I would ask your doctor about that. Jewel says almost 20 years of neurogenic bladder and bowel, recently elevated to suprapubic catheter and ostomy creation. Do you ever recommend these? I do. It's so different. I have people who got a catheter pretty quickly. They didn't want to go back and forth with trying different things, and they loved it. It was the best thing that they could have done for their mobility, their self-esteem and confidence. And then I have other people who wait many, 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 many years to even consider something like that. So I think a lot of this is really just what you're comfortable with and what helps you feel like you get your life back. Because oftentimes these symptoms, bowel, bladder, or sexual dysfunction, they make you feel like a different person. And anything that you can do to feel like you get your life back, you get your control back, whatever that means for you, is something to consider. So it's going to be different for everyone. If you're comfortable with that, then I would recommend those. If not, there's other options. How is sexual dysfunction defined? Sexual dysfunction can be anything from pain with sex, low libido could even be considered sexual dysfunction. Oh my gosh, I'm like blanking on all the different, it's anything that is happening sexually that you're not happy with. That is how I would explain it generally without like giving specific bullet points. Oh, Dion says cocoa butter for dark marks or burns. Thank you, Dion. I didn't know that. Awesome. Okay. A doctor can also prescribe a topical for burn marks. Yes. So these are the exercises. Again, we're not going to review all these because some are on the floor, but we're going to review diaphragmatic breathing. This is something that can give you control. When you can control your breathing, oftentimes you're more likely to be able to control your urinary symptoms and bowel symptoms. Now, we're also going to do some strengthening and stretching. So when we're talking about urinary, bowel, pelvic floor, sexual dysfunction, all these things, more often than not, the exercises should be a combination of stretching and strengthening and control. Rarely is it just one. And that's where I kind of want to break the stigma of Kegels or Kegels, everyone says it differently. It's the exercise where you squeeze your pelvic floor and then relax. They can be great for some people, but some people need to heavily focus on the squeezing part. Other people do not need to focus on that. They need to focus more on the relaxing and fully relaxing. And so Kegels are not one size fits all. There's so many other types of exercises. So for strengthening, it's things like bridging, which strengthens your hips, or ball squeeze, which can strengthen your inner thighs. For stretching, it's like the figure 4, which is the outer hip. It can be child's pose, which can be more the back of your hip. The butterfly, which could be your inner thighs. So again, it's going to depend on what your specific areas of tightness, weakness, etc. are. But these are some really great just go-tos as something you can start doing before you have your appointment, just to get something going. Okay, so we're going to do several of those. Oh, as always, this is all the places you can reach me. Social media with Facebook, Instagram. I have my podcast, YouTube, especially if you like watching exercise videos, that's going to be a great place. And then, of course, the missinglink.com is my website where all of my things exist. My book, my courses, working with me, all things like that. So we're going to practice some exercises, but I see Karen says, I'm fortunate to have been referred to a pelvic floor physical therapist in my area. I had the internal exam you described and was helpful in exercises she recommended. Good, yeah, absolutely. Okay, so exercises. I'm just going to do them from a chair. I really love doing seated exercises because most of us sit throughout the day. So if you know what some of these exercises are, as you think of them throughout the day, you can just stop and do them. With that in mind, you can do these from any chair. Some of them you can do from bed or a couch, the floor, whatever works for you. So let's start with diaphragmatic breathing. I'm going to take a sip of water. Okay, diaphragmatic breathing is tricky. So many of us breathe in a way where when we take a breath in, our chest comes up. Did you see that? Watch my chest again. And when we exhale, we calm down. Diaphragmatic breathing is the opposite. There's so many benefits to diaphragmatic breathing. I feel like we could have a whole lecture on it. I'm going to pull that back now. Diaphragmatic breathing is also called belly breathing. You're going to take your hands, put them on your belly. I really loved when I was pregnant about a year ago because it was so easy to see my belly move in and out. It's a little bit harder when you're not pregnant, but you'll get the idea. So I like to touch my my middle fingers to each other just so you can get a visual. And you're going to be relaxed. So you're reclined, hands are on your belly. And what you're going to do as you breathe in, you're letting your belly expand. And as you exhale, you're letting your belly come in. So I'll show you from the side. And the reason I like to have my fingers touching is because when you expand, they should come apart. So inhale, I like to breathe in through my nose and belly comes out. Exhale, belly falls in. Inhale, exhale. So you're just going to keep going like that. It's hard to do while I'm talking, but as you inhale, your belly comes out. As you exhale, your belly comes in. Instead of going up and down, we're going in and out. It's a way to activate your vagus nerve, which is a nerve that is so important for our bowels, our bladder, but also just stress levels. So belly breathing. That's one of the exercises that you can do. You can do that throughout the day, anytime. You can stop and just do 3 breaths. You can put a timer on, maybe do it for a minute, whatever works for you. But belly breathing is amazing because not only does it help calm our nervous system, it can help with controlling the pelvic floor. Once you get really good, you can do that in addition to Kegels. So you would breathe in as your belly expands and your pelvic floor lowers and relaxes. And then as you exhale and your belly comes in, your pelvic floor comes up. So it would be breathing in, pelvic floor lowers, exhale, pelvic floor comes up. In, exhale. So that's really advanced. For now, just focus on the breathing, but if the breathing was easy for you, you would add the pelvic floor up and down. Okay, the next one that I want to review for strengthening is a seated clamshell, which can be similar to the bridging exercise. So what you're gonna do, and never use a wheelchair, this is the one I have in my office, but what you're going to do is you're going to sit towards the edge of your chair, up nice and tall, and your feet are touching and knees are touching, and you're going to open your knees as wide as you can without your ankles, I know you can't see my feet, but without your ankles rolling to the side or your feet moving. You want to keep your feet touching the whole time. Open and squeeze, 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 squeeze those butt muscles. Relax and close. Open as wide as you can without your ankles rolling or feet moving. Squeeze your butt cheeks. Relax and close. So hopefully you're feeling this exercise in your glute area. That's why this is a hip strengthening exercise. If we're going really advanced, you can add the pelvic floor up and down as well. As you're opening and squeezing, you're squeezing your pelvic floor. As you relax and lower, you're lowering your pelvic floor. Again, that's really advanced, but if you wanted to add this pelvic floor specific component, that's what it would look like. But your main focus is on squeezing your glutes. Weak hip muscles can cause pelvic floor symptoms and dysfunction. Okay, another one was ball squeeze. You don't actually need a ball. I often just use my fists. You're gonna close your fists. You're not squeezing too hard, and you're gonna place them between your thighs wherever your arms land. It will depend on how long your arms are. And what you're gonna do is lightly squeeze in towards your hands and then relax. And this strengthens your inner thighs. If you wanted to add the pelvic floor component, what you would do is you squeeze in as your pelvic floor comes up, and then as you relax, you lower your pelvic floor. In, relax. In, and relax. So that's what the ball squeeze or the inner thigh squeeze would be, regardless of what you're using in between your thighs. And then for our stretches, the outer hip that we just strengthened, having flexibility there can be really beneficial too. So this is the figure 4 stretch that I like. This can be an advanced version. If this is hard for you to get into this position, you would just cross your leg over the other ankle. And then regardless of which position you're in, you sit up tall and hinge forward. And ideally, you're feeling a stretch somewhere on the outer part of your hip or thigh. So this is what it would look like if you're doing the version where it's up. And then you would do the same thing on the other side. We're going through these very quickly. You would want to spend a decent amount of time doing these. For stretches, you'd want to hold about 20 to 30 seconds. Do that 3 to 4 times per side. For the strengthening exercises, I usually do 10 repetitions and do them about 2 sets if possible. And then the last stretch I want to show you is an inner thigh stretch. So this could be if you're sitting on the floor or on a bed or a couch, it could be the butterfly stretch. But when we're sitting in a chair like this, I like to open my feet and my knees as wide as I can. Hands on your lower thighs, not your knees, but your lower thighs. And you're trying to push them out as you hinge forward. And you should ideally feel a stretch somewhere in your inner thighs. It might feel more on one side than the other, but somewhere in your inner thighs. You can add a turn if you want. When I'm turning to my left, I feel more of a stretch in the inner right thigh. If I turn to my right, I'm pushing out. So I'm feeling more of a stretch in the inner left thigh. By getting some flexibility in some of our hip muscles attach to our pelvic floor. So stretching these hip and leg muscles can be helpful, really helpful for our pelvic floor. Okay, that concludes our exercises and talk. So let me know, we've got about 10 minutes left. Now, let me know what other questions you guys have. I see Lori's asking, for anyone on the fence about using catheters, I was horrified at first, but have been using an intermittent catheter for over 20 years. It's such a relief to know my bladder is completely voided rather than having to find a restroom in the next 30 minutes. Thank you for sharing that, Lori. I appreciate that. Dion says, how many times, oh, good question. How many times a day or week would you recommend? It really depends on your level of weakness or tightness, your other symptoms that you have. If this was the only thing that you were focusing on, then I would say to do these exercises 5 to 6 days a week. And again, it depends if you're doing all of these in full sets or not. It could take a while, which is why it depends on so many other things. But I would focus on a handful of pelvic floor exercises, whether you do them throughout the day or all at once. If it's a big struggle for you, 5 to 6 days a week. If it's something that it's there, but it's not really bothering you too much, then I would say the diaphragmatic breathing daily. That's just going to be good for all of us. And then maybe one strengthening and one stretching, maybe 3 days a week. So less frequent. Please start the breathing while doing the exercises. So the breathing, so here's what the main thing to know. Inhale through your nose, belly comes out and expands. Exhale through your mouth, belly comes in. So I'll turn my camera down so you can see what my belly is doing a bit more, but that's the concept. Inhale through your nose, belly comes out. Exhale through your mouth, belly relaxes. I'm making big movements with my hands. It's a small movement. If someone were looking at you, they might not see anything happening, and that's okay. But that's the general concept. When it comes to doing the breathing during the exercises, I would only recommend you do that if you already are 100% confident that you're doing the breathing correctly and it's not a challenge for you. If you're at that point, then you, as an example, let's do the clamshell exercise. So what that would look like would be belly breathing. So before the clamshell, let's just do one of the belly breathing. So in through your nose, belly comes out. Exhale. Okay, if we're going to add that to the clamshell exercise, the breathing in, hold on. The breathing out is when you want to be tightening. So the breathing out is when we're opening. So I'm going to breathe in and my knees close. Now, of course, you can't see my pelvic floor right now, but what I'm doing is when I'm exhaling, now I got confused. When I'm exhaling, my pelvic floor is tightening and lifting. When I'm releasing my breath, it's lowering and relaxing. So you can't see the pelvic floor working. It's more a sense of mentally focusing on your pelvic floor and are you lifting? Are you lowering? If you have not done this type of work ever, you might not feel anything. That's okay. Still practice on mentally focusing on lifting and lowering, tightening and releasing your pelvic floor. Eventually, you will start to feel something happening. It might be 5 weeks from now. It might be 2 months from now, but still practice. Just because you can't feel it happening doesn't mean that it's not going to happen or that it's not there. We just got to build that sensation and awareness. So yeah, hopefully that makes sense. Yes, I have to use catheters, but can we be able to urinate normally with exercises to get that ability back? But are we able to urinate normally with exercise to get that ability back. Gotcha. So like if you weren't, can you get to a point where you don't need a catheter? Potentially. Again, it's going to be different for everyone, and it depends why. If your urinary symptoms are more so due to neurogenic bladder, exercises don't have as much of an effect on those types of urinary symptoms caused from a neurogenic bladder, because that's more due to the neural pathways and the mis-signaling. Whereas if it's due to muscle tightness and weakness, then that's more of what these types of exercises can help with. So it depends on what your specific symptoms and issue and reasonings for these symptoms are. If it's more of the weakness and tightness, then I would assume yes. I'm not a pelvic floor PT, but it also depends how weak are your muscles, how tight are your muscles, how long would that take to get to that point. So, but those are my thoughts on that. With breathing and adding a Kegel, pelvic floor up and down, which order? So the idea is that anytime, hold on, I gotta do it myself before I say it out loud. The idea with exercise, pelvic floor or otherwise, is that what you exhale during the hard part. So, or you're exhaling when you're contracting. So with the breathing, and the Kegel specifically, when you're breathing in, that's the easy part. Relax, pelvic floor lowers, everything's relaxed and smooth. When you exhale, that's when you tighten. Inhale, relax, tighten, and exhale. So in terms of which order, it doesn't, I don't think the order, maybe I don't understand the question, but it's when inhale is relax, exhale is tighten. Hopefully that answers the question. Larry says, thank you. Remembering to keep trying because neuroplasticity is always a good thing. Yeah, and I will say too, just from personal experience, I have been a huge advocate for pelvic floor physical therapy for about 13 years now. But just more recently over, let's see, I guess it was maybe a little over a year ago, I went for the first time, mostly because I just wanted to see what it was like, but also it was around the time that I was pregnant and I was just super interested to see, okay, if I'm telling people to go to pelvic floor PT, I need to know what that evaluation is like. I need to know what's going on. And so I went, and it was so informative. And I will say my pelvic floor PT gave me an exercise to do, and it was more of the relaxing part of the pelvic floor, and she had me doing that type of belly breathing in lots of positions. Today, we just reviewed it sitting. You can do that belly breathing with that pelvic floor raising and lowering in so many different positions. And there was one specific position that she had me do it in, and I couldn't feel my pelvic floor releasing or relaxing or moving at all until it was the 5-week mark, when I was like, oh, okay, I'm just starting to feel something. And I don't have MS. My neural pathways are fine. So if you're not feeling something, that doesn't mean it's not working or that it's not going to happen. MS can make it harder for these muscles to engage. So it very well could be several weeks, if not a month, 2 months, 3 months before you start to feel something, but still keep trying, keep doing the exercises with the mindset of what is supposed to be happening. Denise says, I can't see you. Shoot, can everyone else see me? I have my video on it. You should, okay, Dion can see me. Karen can see me. Denise, I wonder, okay, everyone is saying yes, that's great. Denise, I wonder if maybe the camera, or not the camera, the screen is behind another screen or minimized maybe. Okay, lots of people can see me, good. I'm glad to hear that, but also Dion, I'm sorry that you can't, I'm not sure where it is. All right. Well, that brings us right up to the time. So thank you so much for tuning in today. Again, this is a topic that needs to be talked about more. So often it's not talked about, and then when it is, we blush and we get uncomfortable. This should not be, this conversation should be a normal conversation to be having, especially with your healthcare providers. So I would highly encourage you, if you haven't had this conversation with your in-person physical therapist or with your neurologist, you mention it. It's so important to figure out why these symptoms are occurring, because there are solutions to help. And that's not always the case with MS symptoms. So having these conversations, trying to determine with your healthcare professionals what might be causing this. Is it more neurogenic and the neural pathways, or is it the tightness and weakness? Is it both of them, which can absolutely be the case as well. So I hope you found this helpful. Have these conversations. Try your best to not be embarrassed about them. I know that's easier said than done. But I always love when my patients tell me that they're struggling with these symptoms, because once I know, then we can do exercises that help. If we don't know, we might be completely missing a whole muscle group that we should be working on had we known. So yes, thank you to you guys for tuning in and joining, to MS Views and News for partnering with me to offer this to you, and to our supporter, Viatris. I did just see something come in the chat. Let me take a look. I've told my uro and he didn't help much. If you've told someone, I'm glad you said this, if you've told someone they didn't help much, see someone else. Whether it's seeking a second opinion, going to a different physical therapist, every healthcare professional is different. And if you're not being heard, that is a huge red flag to get a second opinion from someone else. Yes, more talking. Will we be able to go back and view this video? Yes. Let me grab the link for you. So MS Views and News grabs the recording. Let me grab you the link. And they post it on their YouTube channel, but I'll send you the link here. Okay, just send that to everyone. Andrew says he helps with Botox, but for sex issues couldn't help. Yeah, I would say seek out, whether it's a different neurologist, a different urologist, a different pelvic floor physical therapist, maybe asking for a referral to pelvic floor physical therapy. There are other people that can help. If you could do another with the exercises and breathing, that would be helpful. There are a lot of cutbacks in programs. Yeah, we can definitely, we'll see, we have like our monthly lineup, but we can definitely add that back in if that's something that you guys are more interested in. I also do have exercise classes on my YouTube channel. The thing about the diaphragmatic breathing with the exercises, and it is helpful to see, so I like your idea of having another one where we do focus on that, but generally speaking, between now and whenever we host that session, that what I mentioned for the guidance still stands. So you want to be exhaling through your mouth. When you exhale, that's when belly muscle is tight and pelvic floor lifts. You want to be exhaling during the part of the exercise where you're tightening or contracting muscles. So like even if we're doing a bicep curl, the part where you're contracting your muscles is when you're lifting. So that's when you'd be exhaling. Your belly comes in, your pelvic floor lifts. Inhale, everything lowers, belly comes out. Exhale. So that's the general concept for any exercise, whether it's upper body, core, lower body. So I hope that helps in the meantime. All right, cool. That's all I've got for you guys today. Thank you so much for tuning in and participating. I love when you guys let me know where you're at and what your questions are so that I can fine tune what I've planned on talking about to you and your symptoms. So thank you so much. This recording should be up within a week or so on MS Views and News YouTube page. I gave you the link for that. But until next time, have a great rest of your day and a great month, and happy MS Awareness Month. Bye, everyone.